For those of you joining, thank you for joining us today. We're going to get started in just a minute. Just going to give more people time to join. Just going to give it another minute. For those of you that didn't hear, I think you hear when you're joining, but just in case, this is being recorded. We're going to share the replay with everybody who couldn't make it, as well as all of you, so you don't have to worry about frantically taking notes. You'll get the video replay, and then you're also going to get the presentation as a PDF. And anything in the presentation that is underlined will be a clickable link taking you to a resource. Okay, I'm going to wait like 30 seconds more. There is so much to cover that there's no way we could cover it all in one webinar. So what I'm going to do is give you an overview and let you see all of the information and the resources that we've gathered. We're in the process of gathering more information and more resources. We will be holding future sessions in the not too distant future. They will be soon. And we're also going to be inviting some parents who have gotten insurance approval or gone through some of the process, fundraising and different things like that. So we're going to get them on to share information with you. At the end of today's session, we're going to have about 15 minutes for Q&A. Everybody is going to have questions, I think, and everyone's going to want to talk about their specific experience. And so just know that we're probably not going to be able to cover everything. We'll do the best that we can, but you can always reach out to us directly, and we can have a direct conversation. And like I said, there'll also be future webinars that we'll make sure that you guys know about. So I'm going to just get started. So the first thing I wanted to go over with this illustration is up here, we have the Trexo. So this is the goal. And everybody's going to have a different path to getting there. So some people, it's going to be smooth and easy, and they're going to go straight there. Other people, it's going to kind of be a long and windy road. Some people might get blocked or stopped in the middle. And all of it's okay. It's maybe not ideal and it might be frustrating. This is a process that's going to require diligence and follow-up and persistence. And so I just want to be real upfront about all that. And so keep in mind that your journey through the process of getting a Trexo funded might not be the same as somebody else's. So one of the first things I think you need to define is, what are your goals? So up here, we're looking at, what are you going after for your funding sources? Are you looking at insurance coverage? Are you looking at grants or fundraising or foundations? Are you looking for state programs, in Canada, provincial programs, any kind of government funded waiver programs? And then you want to look at, are you looking at multiple different sources and you're just going to take whatever amount you can from each of those sources and pool it together? Are you looking at leasing, raising the funds for lease for 1 year or for the full 3 years, or essentially purchase in full? And so if you have these in mind, it'll make it easier for you to make your action plan. There is a lot of text on some of these slides, and I'm not going to go over every single word. I'm just going to kind of hit some of the key points. And like I said, you will get this as a PDF so you can read everything. What really stood out to me, and if you go to our website and go to in the news section, you will see that there was some media coverage on George's story. But what really stood out to me here was the community support. So within 2 weeks of starting their GoFundMe with a goal of raising $50,000, they had 400 donors and more than $48,000 raised. And so one of the things, if you were to read the full story, Lauren, the mom, talks about having to swallow her pride and just realize that they needed help and that it was okay to ask for it. And I think that might be a big hurdle that some people face. And so just wanted to acknowledge that you're not alone in this. And, there are going to be people that have experienced and felt the same thing, but ultimately, when you do what it takes to raise the funds, you're going to be so glad that you did. And I just realized this little link that says source, that is actually the link to the story. If you want to read it all, you can click there. The other thing that was really great is you definitely want to click on that and look at their GoFundMe page. Their GoFundMe page is really great. The way the details that they've told and the way they laid it out, it's a really good example that you could model your page after, even if it wasn't GoFundMe as your platform. And one thing to keep in mind, depending where you live and what the various rules are, in many cases, GoFundMe donations are counted as income. And so that income could be counted against you in terms of other services or benefits that you're getting that are related to income. So you want to make sure you keep that in mind. We'll talk a little bit more about the different platforms that are available later on in the presentation. And so, of course, this is why we're all here today. Everybody's got a kiddo who we want to get into the Trexo. And so we're going to talk today about federal government funding sources and state or provincial for US and Canada, local, and then insurance, private insurance, fundraising, crowdfunding, grants, foundations and organizations, and Make-A-Wish. And while we've done a lot of work and we have some comprehensive resources here, like I said at the start, we don't have everything. Our goal is to get everything, and we're going to continue to keep working and sharing information, but we've got a really good start here. Another case study. So this was in the US, Danielle and Julian, and they did fundraising to get their device. And what I thought was noteworthy about this one is they got their device for the first year to gather data. And then they were able to submit and go for insurance coverage after, based on the data that they had gathered from the 1 year of usage. So they would have had doctor's notes and things like that documented about Julian's progress in that first year. And then the other thing that she talked about is, you don't have to let the full amount intimidate you. You can focus on fundraising for just 1 year. And then a comment that we hear from every single parent is, don't give up. You probably are going to have to appeal, but it's all worth the fight. Okay, so now we're getting into some actual resources here. So at the federal level, and again, there's a lot more out there, but these are some places for you guys to start. So these are all links that you can click on, and you can explore some of the programs that are available for you. I'm not going to click on these and go into detail because, again, this is just an overview, but you will be able to access these and read in detail. Now we're looking at state and provincial. And so we're starting with the US state programs. And over here, I've listed some programs that exist in most or all states, and you can get information about those. Up here is a list of all state waivers, and this is really great. You can click on it and you can see the different waivers and see what benefits you would get from them. And then we have specifically the Texas SSES Plus Fund. The latest information that we have on this program is that your child has to be in public school in Texas that you would get $1,500 to use towards a device. Right now, they're very busy and it's about a year-long wait. And they're asking people to apply because if the wait gets longer, at least you'll already be on the waiting list. They do release the funding in groups. And so you'll have an idea of where you stand and when it will be released. This particular program, there's a little bit of confusion to it because they're figuring some stuff out as they go. It's a possibility that more money might be released to people above the $1,500. That's not definite. It may or may not happen. And if it does, we don't know anything on time frame. If anybody's interested in any more information, we have a wonderful mom who did this as well as did fundraising, and she's going to come on and do a webinar with us. So you'll be able to get more information about it. Next, we have the Minnesota CAC waiver, which is Community Alternative Care. And for those of you that know the Courageous Carter Foundation, Tiffany Goodchild is Carter's mom, and she runs the foundation. She has provided step-by-step instructions. So here is the link to the government information, and here is Tiffany's step-by-step, very detailed instructions to follow for anybody who's interested in that. Then we have the California Self-Determination Fund. Next couple slides are going to talk about that. So we'll go to those in a second. New Jersey Catastrophic Fund, we'll go to those in a second as well. Right now, we are working on building resources state by state, and we have 3 done, so we can also send out some other information that is even more detailed, state specific, and ultimately we'll get through all of them, but that's where we're at right now. And then in the US, there are 3 indemnity funds. So there's New York, there's Florida, and there's Virginia. And so each of these are links where you can get more information. We do have multiple people that have come to us with funding through NICA. And we do have a family that just appealed a denial from the New York Medical Indemnity Fund, and they actually won their appeal and are getting the device funded. So those are things that we'll also be sharing more information on, I would say within the next week or 2. So the California Self-Determination Fund, essentially, I'm not going to go through every word here. There's multiple slides. You'll have a chance to read it. But I think one of the key takeaways here is what's right here. It's about an unmet need for your child. So when you're providing the information to enter this program and you're giving things like letter of medical necessity, any other information that you have from doctors or supporting therapists that work with your child, it's important that you tie it all back to an unmet need and a goal. So self-determination is about your child's goal and unmet need. Structure your argument accordingly. So that's really important information. Next is the obtaining the letter of medical necessity from your physician. And we got some of this information from a mom who successfully got funded through this. And so she's shared some insights that you'll be able to read through here. We do have a sample here of a letter of medical necessity, so you can access that. You can share it with your physician or any of your therapists that are going to be helping you craft that letter. It is based on feedback and what's worked for families in the past. The next one, the next point in this step, and this is again something that every parent says to us, and that's if you're denied, don't give up. They count on people giving up. And so take it a step further, appeal it. In this case, you would appeal through a hearing. And there is a little quote from a mom here that you can read, her feedback going through it. But ultimately, the bottom line is don't give up. It's a bit of a fight, and it's important to do. One thing also that I wanted to share is the family that appealed the denial on the New York indemnity medical indemnity fund. One of the reasons that the judge who decided they would get funding decided that was based on the doctor's statement in the letter of medical necessity that it is a necessary device. We're having some scenarios where people are considering it possibly a trial or experimental. And although we don't have all of the studies that we will have in the future, we have linked some information and some studies that you can use. It's well documented, the benefits of gait trainers, and having a doctor who's observed the improvements or the ways that your child has benefited from the Trexo, even if it was just from a trial, even if you just came to an open house and you can just talk about steps that the child took that maybe they've never taken before. You really want to focus on all of that stuff. It's going to be really important to getting the funding. Now, here's an overview of the New Jersey Catastrophic Fund. And again, anything that's underlined is clickable. So this is the source of this information, which is going to be the government site. And I wanted to share this with you because this is just sort of the simplest overview. It has to have incurred prior to the child's 22nd birthday. And then there's some income requirements. So you can look at those. There's the phone number that you can call. And then this talks about who is eligible. So it gives just a little bit more information. And then it talks about what could be covered. And so specialized pediatric ambulatory care. So the Trexo would be eligible, also medical equipment. So it would be eligible. Here's a little bit more information about how you apply. So you can click here to apply. You can click on this link to get an overview of the process. And then step by step, here's what's going to happen. Now, one thing, this link is actually going to take you to this graphic, which is really handy because it gives you an overview at a glance, each of the steps and the approximate time frame. So it takes something that could be complicated and breaks it down and gives you something at a glance to work with. So great resource for anybody in New Jersey. We have some provincial funding sources that I wanted to share. So again, all of these are links and you can learn a little bit more about each of them. The assistive devices program is not something that Trexo is currently in the program, but that is something that we are going to focus on. There is also, through the Ontario March of Dimes, specifically a program for assistive devices as well. So you can explore these different provincial supports that are available for people that are in Ontario. This is another great case study. So this is, the mom is Tanja and Fiona is the kiddo, and they got the Trexo initially through Make-A-Wish. And then they did fundraising to be able to continue with it. So one of the biggest things that Tanja had said was persistence. You can see here, it took her almost a year to convince Make-A-Wish to gift the gift of walking to Fiona. Later on in the presentation, there's links and information on how you can apply for Make-A-Wish and what the criteria is. But the common theme that we keep coming back to is be persistent. Another theme that comes up often is use the media. Local media is always looking for coverage, and most of these case studies that we're sharing here have had media coverage. as part of their fundraising. And it's a great way to increase awareness and exposure and to get donations outside of your network. A lot of interested viewers will just donate to things like this. Local, none of these have links because the link would vary based on your particular area. I did include a couple specific to Toronto that came up. These ones are all for Canada. What I found, and I think it obviously varies by your workplace, but a lot of resources were saying check with your workplace. In some cases, there is funding that is set aside to help parents with children with disabilities. So never hurts to ask. So you would want to, if you're looking at funding, just look up the contact info for these local organizations and see what is available and what you have to do to get it. Another thing, I mentioned local businesses, and we'll talk a little bit more about that, but local businesses have in a lot of cases matched donations for families, and in some cases donated a specific day where all of their profits on that day would go back to your kiddo. So it's a great way to partner with local businesses and do fundraising. If media is involved, they're going to be more inclined to want to do it because there is exposure in it for the business. And if it's a business where you have a relationship, a dentist, a doctor, a hairdresser, a therapist, anything like that, then they're also obviously going to be more inclined to want to help out. Now we get into insurance. So this is a big topic and an important topic. And so again, I just want to reiterate that this is going to be an overview. The idea of today's presentation is to let you know what's out there and what's available. And then, as I mentioned, we're going to do follow-up sessions to get you guys more information. So it is important to remember, if it's underlined, it's clickable. So this is what we're calling our treasure chest of information on insurance. So you can click on that. This information is taken from that. So these are the approvals that we have currently gotten. So we talked a little bit about the regional center, which is California Self-Determination Fund, done through regional centers. So they have currently paid for a one-year lease for a customer and paid for the full Trexo home purchase. And then we've got listed here all of the different approvals that we've gotten. And so here, NICA, we talked about NICA in Florida on a previous slide. So we have a broad approval for those. So that's really great for people in Florida. Here we have, again, the New Jersey catastrophic illness. So we have an approval from there, the New York Indemnity Fund, as I mentioned. So these are the approvals that we have so far. We're starting to see them increase, and we're starting to see a lot more parents not only submit, but appeal and fight for their approvals. So this is information that we compiled, and this is in the Treasure Trust, but I wanted to include it here, and I just want to say a couple words about it. This is really a team activity, so it's not just you. You're going to need support from physicians, therapists, if you have a neurologist or a GI specialist, if you have equipment suppliers, and then, of course, any public school employees, any benefit coordinators, anybody who's involved in working for your child for the items that they need for their care and for their day-to-day living. We're also going to be part of that team when you're going for funding for the Trexo. So we can do the assessment, determine that your kiddo is a good fit, and share information that we have in the treasure chest. So studies and one-page documents. We share information on what the Trexo is and the functionality. So you're going to want to make sure that you get your team together and that you keep a list of everything that you need from each person on the team and make sure you check it off as you get it. One thing that's suggested is, if possible, trial a Trexo before. because again, even just from one session, you can share information about how much the child was able to initiate and how many steps they took and things like that. Now, again, from our treasure chest. So this just talks about how to write a letter of medical necessity. And there's some information here that you can read. And again, we do have a template. This is more information. And again, I won't go through it word for word, but I wanted this here for you to read when I send you this presentation as a PDF. And even though I've already linked to the treasure chest, I also included a link directly here to the documents, the letter of medical necessity, and other information. And now we have another case study. And so this is one involving a local business. And so Mason's family dentist turned a day of work into a fundraiser. So he designated the day and then he donated all profits to Mason's fundraiser. And once there was some exposure and other businesses heard what was happening, they wanted to join in and help out as well. Mason and his family had a hashtag for people to follow along, but also for people to discover and get involved. So again, the takeaways here are look for community support and get creative. Think about what you can do that might stand out and get some attention for your fundraiser. Now, fundraising and crowd funding. I didn't include the link for GoFundMe. Everybody can find that. It does vary by country, but you can find it. I include a link for Help Hope Live and Coco Pay. Both of those are platforms that allow donors to get a donation receipt. So they get a tax credit when they make a donation. And the money doesn't count towards your income like it would in a GoFundMe. The money is released directly to the vendor. So for example, Trexo, the goal would be set, the money would be fundraised, and then it would be released directly to us. So it's not income that you would have to have count against you on any of your other benefits. And then tips and ideas is a sheet that was put together with help from a lot of different people, just feedback on types of fundraisers, some tips on what's worked and hasn't worked in the past, some fun, cute ideas to do things a little bit different. So again, you can click on that link and go through them. That's something that we'll also continue to update as we talk to more families and learn what's working for them in fundraising. Grants, foundation, and organizations. So these are, if you click on this link up here, all of these will be linked to on this page. So I just didn't carry the links over here. And again, there are other foundations, but these are the ones that we're aware of. In many cases, these are ones that have given funding to families that have gotten a Trexo. So these are all listed here for you guys to go through. Some of them are specific to a particular diagnosis. For example, Love for Lewiston is specific to SMA. And then there are others that are not specific. And there are quite a few for cerebral palsy. And I just want to mention, a lot of people don't realize, but muscular dystrophy will actually give funding for other diagnoses as well, not only muscular dystrophy. And they do give a budget for equipment around mobility devices. So definitely something you could look into. Down here on the bottom, we've got Grant Watch. And so that's a website that just lists a whole bunch of different grants in a whole bunch of different categories. So you can work your way through that. All right, we've got another case study. And so most of you know Mark, or have heard of Mark. Mark's son, Mitch, uses the Trexo, and Mark is one of our CSMs here. Well loved by everybody, as is Mitch. So Mark likes to tell this story, and I'm just gonna paraphrase it for you. But he was sitting at home and saw the Trexo come up in his Facebook feed. and just knew right away that Mitch had to try it. So he checked it out, found out that they were local, and like 20 minutes later, he had Mitch in the car and they were off to the Trexo office to try it out and see if he was a good fit. So after trying it, Mark was even more convinced that this is something that Mitch had to have. So they fundraised for the whole Trexo, and they did it during the Super Bowl, which I think this is really great, creative way to sort of tie it to an event. They knew that everybody's going to be on their phone checking the scores and checking their pools and things that they're involved in, texting their friends. And so they set it up so that messaging would go out on Super Bowl day, and just ask their network to help support them and help them get the device. And so what they had done is they had shared their story through video. So I think that's another really important piece. People can connect more when something is shared by video, but whatever you can do, whether it's writing, photographs, video, you just do the best you can with what you have. Here are some Canadian organizations to look at. I took a look at GrantWatch just to see if it was relevant to Canada. And so currently it's displaying 82 disability grants. You would have to obviously sort of pare them down and see if they're a match for you, but that's a resource. The Ontario Federation for Cerebral Palsy and Easter Seals, I've put a little star next to. Those are really great resources, and there is definitely funding available there. Same for Muscular Dystrophy Canada, as I already mentioned. And then this is just a collection of different funding sources. So some of the links are directly to one source, and some are a list where you follow even more links to multiple sources. Alessandra and Noah, they're actually local, and Noah had come to an open house, and they used video footage and images, pictures from the trial to show family and friends what the Trexo is, how it works, and why no one needs it. They shared it all on social media, and okay, I'm not sure what this says. This was a copy and paste. So anyway, they were able to get the funding for it. And they also had a friend who helped them out. Their friend started a fundraiser page for them, and they were able to get the entire device amount. So having a friend, having somebody can help you out and support you, especially if there's areas that you're not good at, is a really good idea. And another tip, fundraising online is great, especially if you have a network that is spread out and not necessarily just local. And again, video can be so powerful. And that's Noah, and that's his siblings and his grandma. They came in the office to see us a second time. Make-A-Wish. And so here it is in US and Canada. And the way the process works is a child has to be referred, but they can be referred by you. They can be referred by a doctor or physical therapist. And so you just go through the process, you make the referral. The first step is to determine if your kiddo is eligible. And then it's follow up a lot. Be very, very persistent. They get a lot of requests. We are known to make a wish. The wish is called A Wish to Walk, and we've shared information with each of the different chapters so that they're very aware. So it is something that you can request, and they'll tell you about it. Again, local media support can really help. If Make-A-Wish sees the momentum behind the campaign, and it just is something that's getting a lot of attention, that can help you push things along with Make-A-Wish. Now, this is something I mentioned at the beginning, Tiffany from the Courageous Carter Foundation. She was sharing this resource for tips on writing an appeal letter. And I thought it was really great. So shared that with you guys so you can take a look at it. Another tip that came up was focusing on how the device will help save money in the long run. So are there other pieces of equipment or therapies or things that won't be needed? Can you point to any area that you're thinking your kiddo's health will be improved? And maybe we have some case studies or some studies where we can show that there have been benefit in that area. And so you can use that information. And again, that's all linked in the treasure chest. But definitely for the insurance companies, obviously, they're looking at the money. And so if you can tie your appeal to how it's going to save them money, that's going to help a lot. This quote is from a mom, and again, I'll let you guys read it, but one of the things that she said, she actually got approval from Sun Life Insurance in Canada. And one of the things that she said was it wasn't an easy process, and there was a lot of back and forth and a lot of dealing with different people. And she said, ultimately, when they realized, like, these are people too, and it's not that they don't want to support their clients, but they're bound by the parameters of the plan. And so it makes it really important and simplifies the process to the extent that it can be simplified or made easier by making sure you research and understand your own coverage and your own plan, and then figure out why, within what coverage you do have, what is allowed, why this applies, and it can help you create a better submission. This particular mom just got back to me right before the presentation started, so I will be including information on what she did to get her Sun Life approval when I send this out to you guys. And now we're going to open up for questions soon, but I wanted to go over a couple next steps. And this is something that's really important. We can do an assessment for you. That's interesting. I want the arrow to point to it. Okay, so we can do an assessment for you once we have a reservation. So once we get your reservation fee and we have you in the system, we send you the information. We give you instructions and guidelines. You submit the assessment form back to us, and internally, our team reviews it and determines if the kiddo can safely use the Trexo, if they'll benefit from it, what accessories are needed, which helps finalize the pricing. And then we're also able to offer you support and answer your questions and help you. We don't have an insurance department, but we do the best that we can to support you. Many of you know of our CEO, Manmeet. He's very, very well versed in a lot of this stuff. It's really important to him that he dive into this stuff and understand it so that he can help support parents. And Allison, who handles our sales, she's very knowledgeable as well. And Jade Evan Alejandro and our account coordination team are very knowledgeable. So once you place your reservation, you have the support, you have the approval to know that the device is going to be beneficial and safe for your kiddo, and you'll have that final pricing. And so that's really important. One thing to note is the reservation fee is fully refundable. It's $499. And if your child is not a good candidate, or if you change your mind for any reason, the deposit is refundable. It's just the first step so that we can start this process. The next step would be to get started on your campaign. And so even if you're not going to be getting the Trexo for a while, you don't know how long it's going to take you to fundraise. Some people have done it in 4 days. Some people have done it in 6 months or more. And so you want to just get started so that when it comes time to get your Trexo, you're ready with the funding. So the next step would be to set your goals. So remember at the beginning, we talked about, are you raising for a year, or are you racing to purchase? Are you combining fundraising with another source? Are you getting multiple grants? So kind of figure out your action plan and then look at what platforms you need to use and just get going with it. And some final thoughts before we open it up to questions. It may not be easy, but every single parent have told us that it's been worth it. Every single parent have also mentioned that they're surprised how much people want to support. They just need to be asked and they just need to understand. And so if you don't ask, you never know. And the other thing is, I've heard a lot of talk from parents about pride, and I have to swallow my pride and ask for help. And the truth is, it takes bravery to ask for help. It's hard. It's hard for all of us. But it's for your kiddo. And so, like I said, it kind of circles back to the first point. It's really well worth it. So that's the end of the overview. And now we will start going through questions. We've got about 19 minutes to go through questions. I do want to tell you in advance, if there's information that I don't know, I will get you the answer and I will get back to you within one business day. So bear with me if I don't have all the answers right now. Let me just see what questions we have. Okay. So yes, one is will you send out a link to the slides so that you can click all the links? I will be sharing that with you guys for sure. You'll get that tomorrow along with the video replay in case you want to listen to anything again. Off the top of your head, how many Canadian families have had insurance partially and or fully cover the Trexo device? I want to verify with my team, but I believe that is one. I believe that is Lindsay, who got covered for Sun Life, but I will find out and get back to you just in case there's anything I don't.
I think it's a couple. But yeah, it's a lot less families have tried to go on the insurance route in Canada in general.
Thank you. So see, I got you the answer right away. And for those of you that don't know, that's our CEO, Manmeet. As I mentioned, this is really important to him to support families. And so he was able to hop on and join us today. Thank you, Manmeet. And I'm probably going to call on you to answer some other questions. If we've been on the waiting list since October 2022 and finally raised the money, about how long does it take to get a Trexo? Manmeet, do you want to cover that one?
Yeah, it really depends. Probably Jaydev or Alejandro can probably answer this better in terms of what the timeline looks like right now.
Okay. I can tell you that for new reservation holders, we have a very long wait list. The Trexo is really in demand. For new reservation holders, we are looking at next summer. So it is a great time to get your reservation in, get your spot on the list, and then you have plenty of time to raise your funding. For an existing reservation holder, Jaydev, Alejandro, do you want to share any thoughts on that?
So for an existing reservation holder, I believe it depends on a lot of factors, but I think I would suggest to best coordinate with your account coordinator at Trexo. If you don't have any contact or you haven't been in touch with us for a long time, you can just email us at hello@trexorobotics.com. So for existing reservation holders, it's like some can get it like this year and some will get it like early next year. But for new reservation holders, it's summer of 2024 or sooner than that.
Great, thank you. Next question is, you mentioned an open house. Will you be having any more of those, or could we schedule a visit for a trial? I'd love to try the Trexo out for my daughter before we really go down this path. So yes, we will be having open houses. Typically, we look to have them every other month. And so we definitely have one coming up soon. I don't have the exact date, but I will let you know very soon. I'll be putting it on the events page on our website. It'll be going out in email. So we'll definitely, and on social media, so we'll definitely let you know. And yes, you could also always contact us, and we can see what we can do about scheduling a visit. Okay, next question. If you buy the Trexo and your kid outgrows it, do you have to pay extra to change the pieces, or is it covered? There are upgrade fees. You don't have to purchase a whole new device, but there are upgrade fees. And then if it requires a new Riften, you would also be responsible for that. And the fees vary based on what size you have and what size you're upgrading to. I will include that in the information that I send out, because that's a question that we hear a lot. So I'll give you the details. Okay, next question. Can we try out a Trexo in Alabama? On our website, if you go to the locations page and type in your location, you can find out what facilities nearby have a Trexo. Keep in mind that we don't have other locations. So any of these locations listed on the website are businesses, typically clinics, hospitals, physical therapy facilities that have purchased the Trexo. So you would have to make an appointment and pay whatever their fee is to try out the Trexo, if there's one close by you. We have done
But oh, sorry. The
no,
good
go
news
ahead.
is Children's of Alabama also has the Trexo.
Oh, perfect. Excellent. And we have done a little bit of traveling, and there will be traveling in our future as well. The best way to stay apprised of any new facilities that come on, any travel that we're doing, any open houses, is to follow us on social media and also get on our mailing list. We make sure that we share information on all of that. Okay. If a location already has a Trexo but does not have a headrest accessory, can that be obtained, and would there be a fee? So accessories are available through Riften. So you would be able to contact Riften and get the accessory that you need. And yes, there would be a fee for that. Okay, and then okay, so that was just, thank you, Trish, for sharing. For Alabama, yes, Children's in Birmingham with a doctor script. Okay, is there a version that has the ability to turn in the works at all? Not sure I understand. Elizabeth, can you type a little bit more and clarify that for us? In the meantime, oh.
I presume you're asking a bit about like to do power turning, ability to turn. Right now, the Trexo is designed where the steering is fully controlled by the caregiver. Yeah, that the current version don't really have a clear pathway or a clear answer on what the future versions might hold for us. But yeah, it's designed so that the caregiver has full control, both from a safety perspective and also a feasibility perspective.
Great, thank you. If I'm looking into purchasing a Trexo for our clinic, is there training that needs to be done for the therapist? If so, what does that look like? Whether it's a family purchasing a Trexo home or a facility purchasing a Trexo Plus, we provide training and support. In fact, we require that the Trexo be operated by somebody who is trained. And so the training happens virtually. We typically would use Zoom, go on a video call with you, and it would be done with one of our CSMs. It's typically about 2 to 3 hours long, and they go through all of the safety procedures and guidelines. And then they ask that the kiddo be there, and it would actually be the first time that you're putting the child in the device. The CSM is able to see the positioning, see the child's reaction, see what adjustments need to be made. So they help you get everything set up, and then the kiddos can use the device. There are check-ins available. Some check-ins happen like once every 3 months. We're always available if you want to have a check-in more often, or if you have questions. We have a chat app so that you can communicate with us for any support that you need. And specifically for clinics, we will train whatever therapists you need us to train. We just, depending how they are, it might be broken down into smaller groups, just to make sure that we're able to properly train and understand that each individual understands. So that's something that would be coordinated as you're working your way through the process, starting with making a reservation. As you get towards talking about contract, delivery date, things like that, then your training would be scheduled. We don't do trials at schools right now. It's an interesting idea, but it's not something that we are doing right now. Okay, I know that I spoke with Allison several months ago about trialing the Trexo. We live in Georgia, and she mentioned CHOH is getting one, but at the time they did not have it yet. Do you know if they have received it yet? Manmeet?
I don't think so. They've received it yet. Again, I would probably point you guys to Trexo Robotics, the locations page. It's trexorobotics.com/Trexo-locations, and that's an active list of the clinical locations that actively have a device right now.
Yeah. Okay, and I will also include a link to that for anybody who has trouble finding it on our website when I send out the information tomorrow. Does the lease pricing include the Riften Pacer? JDev, do you want to talk about initial fees and what's included?
Yeah. Sorry, what was the question?
Does the leasing price include the Pacer, the Riften Dynamic Pacer?
Okay, so for the lease, I can just give a brief overview of the pricing. So we have 4 sizes for the Trexo: the small, medium, large, extra large, depending on the size of your child. So after you submit the assessment, post the reservation, we can determine what size your child needs. So the Walker, the Riften Dynamic Pacer, is not included in the monthly lease payment. It is something that you can get it through us, and we get like a 35% discount from Riften, and we pass on that discount to customers. Or if you have someone donating, or if you can also get a used Riften Dynamic Pacer. So that's something that's totally up to you, but that's not included in the monthly lease. And the monthly lease for the small and medium is $999 a month. And for the large and extra large is $1,099 a month.
Thank you. And that was pricing for the Trexo Home for families. If you have a Riften frame, can it be turned into a Trexo? It needs to be a Riften Dynamic Pacer, and it needs to be the right sizing. We do our sizing a little bit differently than they do because it does have to accommodate the robotic legs. So it just really depends on the details. And if you're looking to place a reservation, you can connect with Allison and she can help you out. Okay, so then, yeah, I love this school idea as well. Definitely mention it to your schools. And if you guys want us to send information to schools, I'm happy to do so. We are not doing a 1-year lease giveaway this year that I know of. It's possible that one may pop up. Sometimes we have donors that that want to donate, and so it's possible. I can tell you that the Courageous Carter Foundation is accepting applications. They have a board, and you can read on their website the process that they go through. The board reviews the applications based on different criteria and makes a decision, and then one person would be winning a 1-year lease. They're doing a lot of fundraising, and they really hope to continue to help more families. So you can check out Courageous Carter Foundation. Also, if you have a child that has SMA, Love for Lewiston, which was listed in there, also gives funding, I think $10,000 towards a Trexo. And then again, all of the places that are listed in this presentation. Okay, so yes, if Make-A-Wish approve, oh, sorry. Okay, yeah, no, that's the next one. If Make-A-Wish approves the Trexo, do I still get into the waiting list to get it? Yes. If there are special circumstances that we need to know about, that's something that we can discuss. But to keep things fair, in general, people are just placed on the waiting list in the order that they come in. And it looks like we have about 3 minutes left if anybody has any other questions. I wanted to share with you also just this photograph here. This kiddo is named Turner, and this great walk with him outside in his Trexo, surrounded by all these people and all these signs. This was a thank you to all of the people that donated and made them getting the Trexo possible. So it's this great community that just came together, not only donated, but came out to walk with him and celebrate. And it's just a really great example of the power of community when you reach out and let them know that you need support. Any other questions? Oops. All right, I think we're good. Thank you, guys. I will, as I said, send out the presentation, the extra information that I've mentioned. I've been making notes, the replay video, and I will keep you updated on the events that we're scheduling going forward so we can dive deeper into some of these different sources. Thanks, everyone. Sorry, one other thing I want to mention. There is a link in the presentation for you if you want to go ahead and place your reservation. Also, if you're ready to go now, you can just go to trexorobotics.com, and on the top of the homepage, you can click a button to make a reservation. And our contact info is all in there as well. Thanks, everyone. Bye.
Thanks, everyone.